YouTube fam, what's going on? It's Dr. Cameron Brown.
Yes, I'm Dr. Eusebio DeRosia, and welcome to NuWave TV. First and foremost, a little bit about us and what we believe. We believe in helping the body to be free of disease or disease. We want the power of the mind to be understood, and spiritual health is valued. We understand that all of these are important aspects to total health. And we want to use this platform to be able to discuss things that will help improve your quality of life, that will help benefit your health, any aspect of your health in any way. It's also a good way to connect with us and learn about us and all things New Wave. So that being said, why don't we just hop right into it?
Let's kind of talk about the chiropractic profession a little bit and what it is we do and what it is we look for as chiropractors, because I think that's something that kind of gets lost. And what we look for is something called a subluxation. You probably get that question a lot, Doc. I get that question a lot.
No, yeah, definitely. We have patients coming in and they are not aware about or do not have a great understanding about what exactly we do as chiropractic. There's a lot of information out there, videos, they just associate chiropractic with the crack. We have a lot of people addicted to the crack, right?
Addicted to the crack.
But yes, that word subluxations, at the end of the day, that is what we are trained to look for and to correct. So at its core, it's really joints of the body that are not functioning properly. Through the chiropractic lens, it's really malfunctioning of a joint. It could be any joint of the body: ankles, knees, hips, shoulders, wrists, elbows, but primarily in the spine, right? Spine or pelvis. So when these joints are not functioning properly, it could cause a lot of different problems. Pain is a big one, but also other type of symptoms that you may not be aware of or too familiar with, because it actually slows down or interrupts your body's ability, your brain to connect and communicate with others areas of the body effectively via the good old nervous system.
Right. So pretty much is when that bone or joint is partially out of place and we're going in and putting it back into proper place so that the nervous system can function the way it was designed to function, right?
Yeah, that whole out of place thing, I try to be careful with that phrase. It's really just restoring the proper function within that joint. So that joint is not functioning properly. And when you get adjusted, all we're doing is making sure that joint starts to begin to function properly. Because when the body is functioning properly, then your body is able to heal but better. It's able to do the things that you want to do without any problems. And 100% health is 100% function at the end of the day,
That's a good way to look at it. That's a good way to look at it for sure. So
Yeah.
I guess the question would be is, how do you find these subluxations?
Yeah. So a couple indications, right? So there are a couple keys or clues that your body will give to yourself or to chiropractic physician as well. So what we do is we look for these keys and clues. One big key or indicator, right, is pain. Pain is a major indicator, right? Pain could mean a lot of different things though, right? So it's just a piece of the pie. So if you have a subluxation, most likely there's pain associated with it. Not 100%, but more times than not, people come in because of that pain that they're feeling, right? So there's a pain aspect. Joints love to move, so that restriction, right? There got to be some type of restriction in that joint. So it could be a global restriction. So me not being able to turn right as much as I'm able to turn left, right? Or it could be at the actual level of the joint or the segmental level, right? So assessing the joint and comparing it to the one above and below, if there is a restriction in movement, then that could be another indication. Inflammation is a big one, right, Doc?
Inflammation is a big one. And so when we kind of talk about inflammation, not going to get too deep into it, but most people come in because they're dealing with either an acute injury, meaning that they just had, slip and fell and tweaked their back, or they've been dealing with something chronic they've been dealing with for years. And on the acute level, you have inflammation, you tweak your back. So now, we got inflammation there. That's the acute response. That's natural. But on the chronic side of things, if there's a lot of inflammation, then that's where it becomes a problem. And that inflammation in turn can cause issues down the road, developing in other types of diseases or diseases within the body. So, yeah, that inflammation is a big one. And we definitely like to identify whether or not you have chronic levels of inflammation.
Oh, for sure. And there's the different ways we could test for that too. And that's, we'll say that for another time, another video.
Right.
But yeah, so inflammation is a big one. Pain is another one. Restriction in joint movement, or there's a muscular component. At the end of the day, we're not just sticks and bones, right? We're not just bones. There's muscles and ligaments that attach to these bones, and when these joints are not functioning properly, then those muscles will respond, either muscle spasms, muscle fatigue, too much muscle tension, not enough. So there's a lot of different ways your body can manifest indications. Also, posture. Posture is another big one. Everybody kind of knows about that. Our body is major compensators. People could go years and years and years and years with problems, and our body finds a way to deal with it or compensate or continue to, keep going on. Right. And that's something that we try to avoid. But you can start to see that compensation and imbalance play out in someone's posture. So those are some indications that could help us lead us to the conclusion that you may have a subluxation. So we got to kind of do a little bit deeper investigating.
So there's other ways to identify whether you have a subluxation or not, right? So first and foremost, we are palpating the spine. So we're feeling for those subluxations, but there's also other diagnostic ways that we can feel, or we could find the subluxation. And one of those is x-rays, right?
Oh yeah, absolutely. The crazy thing is with technology now, there are so many tools at our disposal to help the patient not only heal, but really dive deep and identify cause root of issues, right? X-ray being one. X-ray has been around for a while though, but we like to talk. We don't guess with someone's health, right? So we do have X-rays that we take in house. If it's necessary, we'll go ahead and go ahead and take it. But what that allows us to do is put the pieces together. Obviously, doing an exam to make sure and actually feel the movement of these joints, palpation, the muscle tissue, all of that. But when we are able to see with our own eyes and visualize the alignment of the spine, and also rule out contraindications as well, of course, but we're able to kind of put that extra piece and actually see what our physical eyes can't see. That right there is a huge tool, because then we could also really come up with a plan that's more tailored to fit the patient. 100%.
No, I'm with you 100% on that too. And
oh yeah.
So
another thing is a mild vision too, right?
Mm-hmm. Oh, mild vision. Yeah, that's right.
I just thought of that.
Good old mild vision. So what is mild vision? So mild vision is basically a device that helps identify an increase in muscle activity or a decrease in muscle activity. So it's not going to look or address anything on the skeletal side. It's strictly for muscles. So we'll use that in office to kind of identify any type of muscle spasms or hypomuscle activity, so lack of muscle activity in one's spine too.
Yeah. The good thing, you know, and what we're really about is having different tools or assessments to help us find the bigger picture. We're all about finding out the cause root of the problem. And these technological advances help us, you know, and once we're able to find the cause root, like we talked about, you know, the subluxations are not only that you have them or not, but to what the degree, and if there's any other, you know, condition that is associated or that it's actually causing or leading to, right? Then we're better equipped to be like, okay, you know, let's go ahead and address this or address that, you know. Um, you know, the at the end of the day, the adjustments will help restore the function to the joints, right? But just like how Doc said, there's a muscular component, you know, there's discs, there's ligaments, you know, there's so many other things that we have to consider when you are in that process of healing. And if you're trying to, you know, get the best results. So we also have like therapies and things like that in the office to just really facilitate healing, to speed that healing time and really support the meat and potatoes of the treatment, which is the adjustment to those that are addicted to the crack.
Right. And then to your point too about the therapy. So those therapies that you just mentioned, they are modalities that are used to address soft tissue. So like you said, the meat and potatoes is the adjustments. That's what we're doing with our hands or other instruments to accomplish what we need to accomplish. But to address those soft tissues as well, that's when we go ahead and incorporate those different modalities like electrical muscle stimulation, therapeutic ultrasound, cold laser, you know, vibrocussor, you know, Theragun, you know, those type of devices we can go ahead and utilize to help speed up that recovery process. And that's when you address both aspects, that's when you get the best results. And that's when we've seen patients get the best results as well. So is there other things that attribute to being as healthy as you can be? And yes, you know, first and foremost, we want to make sure the nervous system is functioning properly through the adjustments. But also we want to make sure that your diet is correct. You know, the lifestyle that you're currently living is of benefit to you. You know, all of these different things, you know, play a factor into one's healing. So if you are consuming the wrong things, then that could cause, you know, a delay in healing. You know, if you are constantly being exposed to certain, you know, things, you know, i.e. certain toxins due to your job, or, you know, the job is super labor intensive, you know, all of these things play a factor into one's health and how one heals and how fast one heals. So we try to incorporate all of these and tailor it to that specific patient so that they can get as healthy as they can, as fast as they can. So that's kind of the NuWave approach. We don't just address, you know, the musculoskeletal side of things. We know that it's mind, body, spirit when it comes to healing. So, you know, we make sure that we address all of those things to best our ability so that the patient can recover and live the life that they want to live and should be living.
No, facts. You were born to be healthy, you know, and it's like, how well are you expressing that health? And just having that holistic approach is pretty much what you're like speaking about, you know. Exactly. Obviously, no drugs, no surgeries here. So when you come to NuWave, you're not walking out with any pain medications or anything like that. But to your point, it's really understanding how the body works. And
but a lot of times it could be from something else. It couldn't be, exactly. It may not just be from said thing, you know.
It's not just stress. Exactly. You know. So, you know, it's once you understand how the body fully works, we're able to use that knowledge and look at the body as a whole. Take a step back and like, okay, we understand that things are connected from how the body works, how the body functions, but also external factors, like Doc said, with what you're eating, you know, what you're exposed to, you know, all these things. So, yeah, I definitely think that is the NuWave, that holistic approach to health, holistic approach to treating the body. People are starting to realize that, and I really think that that's an awesome thing.
Nah, 100%. And another thing that a lot of people, ask or kind of have a preconceived notion when it comes to chiropractic is that I have to go see a chiropractor when I have back pain, neck pain, or migraines. What we really try to educate people on, and correct me if I'm wrong, is the benefit of chiropractic being a preventative service.
Yeah, you have a great quote. I hear you say it in the office all the time. You actually said it earlier today. You're like, the value, my value is not what I'm treating you for, but it's what I'm treating you from.
Yeah. Side note, I can't take credit for that. I got that from somebody though. But yeah.
Okay, there. At the end of the
Yeah.
day, there's so many benefits to chiropractic. You got pain management, obviously, that's a big one, and also corrective care too. We don't only want to just manage the pain, but we want to find out what's causing that, correct that. So you're not managing the pain, but you're out of pain. Your body's not giving you those signals saying that something's not functioning properly, right? The approved mobility, better range of motion. We talked about that earlier with the joints,
Right.
and how they move not only in the spine, but knees, elbows, wrists, shoulders, ankles. The list goes on and on. For all the athletes out there, man, chiropractic, that's not well, to some, it may be a new thing. I know growing up for myself, I wasn't too knowledgeable about chiropractic. However, now it really is known to help enhance, sports performance, especially with the athletes. I think every NFL team got a chiro on staff. Majority of other professional sports team, and that's because of a reason, right? They're not going to invest that money and time if there's not evidence to back it up, if it's not beneficial for the athletes. I think that's kind of how you got into chiropractic too, right, Doc?
Yeah, I mean, you trying to make me get into that story? Nah, I'm not really gonna get it. But yeah, long story short, that's that I playing ball and the athletic trainer was a chiropractor and he had me come to his office and that's when he kind of to enlighten me on the profession because at that point in time I was looking at physical therapy because that's what I knew as far as that's what I was kind of into at that time.
Yeah.
So, but yeah, to your point, now it's every NFL team has a chiropractor. I believe a lot of NBA teams have a chiropractor on staff now too. So, and even in the Olympics, we saw that there was chiropractors.
Yeah.
At the Olympics. So it's
so that's huge. Even if you are not an athlete, but you like to exercise, you like to stay moving, joints love to move. It will help, with performance at the gym, exercise, and just keeping you active. At the end of the day,
right.
You always hear don't have a sedentary lifestyle, but you want your body to be able to handle the stress and the demand that you put on it, right? Especially as you age too. So another big thing is really just enhancing nervous system function. At the end of the day, we're doctors of the nervous system, the nervous system, the brain, spinal cord, nerves, they control and communicate with every aspect of your body. If something is causing an interruption in that, wouldn't you want to know? Because it's going to affect something on the other end. So, we really just, that's a huge benefit of chiropractic, making sure that your nervous system is functioning to the best of its ability. And then stress reduction, man. A lot of people are stressed. A lot of people have a lot of reason to be stressed nowadays, so being able to relieve tension within the spine, within the muscles, promote relaxation, help, just support overall well-being and whatnot. Some stresses you're not able to run away from, so you don't have to have pain per se or have a condition, those are some benefits of chiropractic. But, what we really want to instill in people and just educate people is, you know, just like you go to the dentist, make sure everything's good with your teeth. Just how, like you go, you have your car, you go, make sure you get your oil change, go get your tune-ups. Like you go to the MD annually at least, hopefully get some blood work done, etc. Is anybody checking your spine? Even if you don't feel anything, we want to promote like, hey, routine chiropractic, maintenance, wellness, that type of mindset, making sure everything is functioning properly and staying that way, healthy people staying healthy. Oh man, that's a beautiful thing, and that's really what we're about.
Well said, my brother. Well said. And with that being said, I think that is enough for this video, because we can talk about this all day, obviously, because this is what we do. So
no, yeah. So really quick before we go, please share, post. We definitely want to just have this platform to just chop it up, to talk about the different health topics, but also learn a little bit more about the docs, about what we do, how we think. And so just stay in tune. We're going to have this on our page on YouTube, social media, but also on our website. It's a great way to come to check us out and actually see, post videos and other content on there. And then if you want to go ahead and make an appointment, since you're on the website as well, there's a spot for you to do that.
All right. Any other housekeeping notes?
Oh, no. It's been fun. I look forward to doing it again.
There it is.
Peace.
All right, fam. We'll catch y'all in the next video.
Sir.